Okay, awesome. Thank you all for being here today. We're super excited to have Dr. Bollier be our guest speaker for our first event for Women in Medicine Week. So I'm just going to introduce Dr. Bollier. She graduated from the University of Kansas School of Medicine and completed her residency in anesthesiology at Baylor College of Medicine. And she served in the Kansas House of Representatives and State Senate. And she's the Democratic nominee for US Senate in Kansas in 2020, where she actually broke records for how much money she raised in fundraising. She broke state records, which was really awesome. And so AWS and the OB-GYN Student Interest Group are really excited to have her kick off our second annual Women in Medicine Week. And I'm going to go ahead and turn it over to Dr. Bollier now.
Emily, thank you so much. I am sitting out in Colorado in the library area. It's actually closed today, and we'll talk about it is very relevant to what I have to talk about today, but they actually have internet available out on the patio. So here I am because my home out here doesn't have internet yet. But I met Emily this last year as we were at a clinic in Kansas City, Kansas, administering vaccinations. And since I did not win my US Senate seat, I had plenty of time. So I spent a good 5 weeks vaccinating people in Kansas City, Kansas, which was a great opportunity to help improve the health of our area. So a little background on me, like you heard, I was an anesthesiologist. I practiced in outpatient surgery and retired from that. I didn't know I was going to. I thought I was going to take a brief stint off, but ended up not the year 2000, and then became very engaged in bioethics through the Center for Practical Bioethics that's here in Kansas City. And if you're not familiar with it, please do become. That's a whole different topic of conversation, but I did end up teaching bioethics, 2 different courses to students at the Kansas City University of Medicine and Biosciences, which now has a different name, but they were in a master's program. And there's a great overlay between bioethics, medicine, obviously, law, and faith, as well as culture. And ultimately, that was a huge influence to me because they work on public policy at the center, practical bioethics. And there was an opening in my district for state representative that was unexpected. My state senator, his wife got breast cancer, and he decided he would be done, and he endorsed my state representative at that time. And so I was like, oh gosh, I'm not practicing medicine, and who's going to run for this seat? We need somebody that would be good and is a moderate thinker and willing to listen to the people and do the studying necessary to make good decisions for our law in Kansas. So I ended up running in a special election, winning, and then spent the next 11 years as a state representative and then a state senator. And interestingly, the paths I seem to have taken throughout my life seem to be more male dominated. Medicine, certainly in anesthesiology, it's very male dominated. And anytime I would go to an anesthesia conference, there was never a line in the bathroom for the women. That was always, the measurement of, that it's not very, that there's a big difference between male and female. I grew up playing sports that were more male dominated. I played golf for the University of Kansas, and a lot of women didn't really play golf in those days. That it was just, interestingly, when I was in high school and just starting college, that's when Title IX came into being, which dates me horribly. But, the world has really changed in that women are now, if not equally represented, even dominant in various areas of the world. Not quite yet in medicine, although I think classes are of equal size male, female for the most part. Interestingly, I just saw or read an article about college students, and right now in the United States, women are dominating going to higher education, particularly in college, by like 60-something% to 40%. And that is really eventually going to affect our world very, very definitely. But anyway, I ended up stopping medicine. I was a mother, 2 children. One of my children, my son, just graduated from law school and he's a patent lawyer here in Kansas City. And my daughter is actually in medical school herself in Australia. She has a master's in public health and decided she wanted to practice medicine. And I stopped to be more available to my kids, et cetera, and then found that I had all these other passion areas. I went into medicine so that I could improve people's lives. And I found out that my expertise of the practice of medicine was needed in other areas of our world to help combine those things and make things, health and access to health and good health outcomes, et cetera, more accessible to people, eventually ending up in the legislature. So a question for you all: how do you think the state legislature impacts the practice of medicine for you? And then we'll move on to the US system, government. What do you think? And you guys could just use the chat function. You can even just put your name up there and say, I'll answer, or just open your mic and say, anybody? What do you think? Emily, how did it affect what you were doing, giving vaccinations?
Yeah, I think it affects a lot of the practice of medicine. Just like vaccinations is a good example. Like even, on the county level, like every county in Kansas was doing it differently. And so those decisions are really impactful in how we practice medicine.
So that's really interesting because not every state had vaccination or COVID rules or whatever moved down to the county level. But in Kansas, the state legislature voted and said that it would be a county decision, whereas many states said it was a statewide decision and the whole state was impacted, and I'm reading things. The state legislature has prevented Medicaid expansion, a tragic situation. And it's not, I will be very clear. Years ago, the legislature did pass Medicaid expansion, but the governor vetoed it. So that is your state government at work. And that was actually a physician, Dr. Jeff Collier, vetoed Medicaid expansion, which is a tragic thing for access to care, as I'm sure many of you are aware, and will become more so. I don't know what all levels you are in your studies, let alone if you're staff, faculty, but if you're in the ER, you'll see people that don't have any kind of insurance, or even people trying to see you. And that really impacts not only that immediate care, but what else? Chronic disease. If you don't have care, you can't get better and you can't have your diabetes treated except for the acute emergency situations, et cetera. So a lot of you, reproductive rights are very affected by the state legislature and our law. So who has heard, have y'all heard about this constitutional amendment that will be on the ballot next August in the traditional primary of the state, but it will actually be, everyone will need to vote next year on a constitutional amendment about whether our Kansas Constitution guarantees the right to an abortion. And I hope you're all familiar with that, but if you're not, why does that matter? Who has a thought about that? Does it affect healthcare for women?
It absolutely affects like the direct patients of this, but it also affects the OB-GYNs who are going into practice. And if they have a residency program here, they're not going to be able to learn that care as well.
Exactly. And in truth, it's already a challenge in Kansas. I know because laws were passed when I was in the legislature that I voted against, but they still passed to limit University of Kansas what training you could have about abortion. You can't actually, and it's a very complicated way that people in residency then get their training outside of the state and have funded, et cetera. That really affects. Were any of you familiar with what went on in Missouri, the recommendation to block access for women to certain kinds of birth control? I see Peggy Pruitt. Show your face, Peggy. I'd love to see you. There you are. Yeah. Who knew what happened in Missouri with, was anybody watching that?
Which time?
Well, just recently, so they tried to block the ability as part of all their laws to have access to certain kinds of birth control. So why would that tie into the abortion equation?
You'll increase abortions and the needs for abortions if you don't.
Certainly will increase it. The other is that many state legislators believe that contraceptives, including the pill and certainly an IUD, cause an abortion. They don't, but they believe that. And so they think that women should not be able to have access to those kinds of birth control. Now, is birth control, that we call it, are contraceptives prescribed by physicians just to prevent pregnancy? Of course not. There's all kinds of reasons that we might prescribe that. And yet here is a state legislature deciding that, oh, women cannot have access to those kinds of treatments. Has nothing to do with abortion, why they're prescribed, and yet they're interfering with the practice of medicine and saying they can't have access to it. So it's a huge reason why we as physicians need to be paying attention and getting involved in our elections at the state level, because it impacts the care we can give. So let's go back to the Medicaid expansion in Kansas. Do you think women who don't have insurance are at their healthiest when they don't have routine care? Anybody?
That's a good question, because how would they be evaluated if they're not going to get healthcare?
Right. Like,
But-
so what if a woman has diabetes and she doesn't have health insurance? She's probably not going to be getting the treatment she needs, right? And will not be at her healthiest when she gets pregnant. What do you think of women? Do you think women who are at not their healthiest are going to have the best health outcomes, maternal mortality, fetal mortality, sickness, etc.?
Yeah, you're gonna have, I mean, like even basic things like just infection, things that can be easily treated with like the tiniest bit of healthcare, let alone needing.
What
like,
about prematurity?
Yeah.
All those things are impacted, and yet here we have a state, Kansas, that is saying, we're going to put a constitutional amendment up. We won't expand Medicaid, but we value them both, and we want women and children and babies protected according to them, and yet we won't give them the very care that they need to be at their healthiest. I find that, again, a tragic situation, and that was not why I got into the legislature, but I was very aware as a physician that public health And what we decide in the legislature greatly impacts outcomes. So another example, let's look at COVID right now. Some of you write in the chat function. What have you seen? How the state legislature has voted on issues? Do you know ways that COVID has been influenced by that for you as in what you're practicing? So what about who's getting vaccinated? Was there equal access for everybody? Maybe, maybe not, because every county was responsible. So some counties really, really pushed vaccination, had information given to people, had opportunities, provided transportation, etc., and made it more accessible to people. And other counties felt like, we don't even believe in the vaccine because we don't believe in COVID. So what about mask wearing? Of course, it's been hugely impacted, which then what? Impacts the spread of the virus, which then impacts how many people get the disease, and then goes back to who can be treated and who can't in these various hospitals. Because what we found in Kansas is it started to become, the system was becoming overwhelmed, and certain places in the state, and at KU, I watch your numbers, it gets to the point that the ICU is too full. And then what do you do? So I'm going to give you another example. So I said I'd tie this in. Here I am sitting accessing internet at the library. Do you think Kansans have access? All of them have access to the internet equally? Who here is somebody here from, oh good, somebody from Kate Schumacher. Yes. You talk about how differently COVID was being affected. Yes, it was. It should have been shocking. Very, very different. But what else did in rural Ellis County? Did everybody have access to the internet?
Definitely not. And specifically, I rotated at Rooks County Hospital, and it's largely farmers that don't live near any type of accessible grocery store, library, anything like that. So they were really depending on the family med doctors there, and whether or not they believed what they had to say was a whole different story.
And that is fascinating, isn't it? It's just a whole different world. I will tell you, in my lifetime of practicing medicine, there has never been a time until now where there was so much doubt and questioning of what is real and what is not, and a political divide over care other than abortion and its access. But now it seems to be affecting everything. So Kate, did you find that people, using the internet to take care of people who couldn't come in, was that an option in the rural areas?
And they had the telehealth option, but it was really difficult to actually function for every single patient. I think once again, it was a little inequitable versus who, was in their 80s and whether or not they were willing to use those computers or had the internet access. So it was definitely just very variable.
And that's a really important point. And one of the things when I ran for United States Senate, I was a tremendous advocate for infrastructure improvement in our country, which is what Biden is trying to get passed right now through our House and Senate up in Washington. And as you look and see a Republican physician, US Senator from Kansas, criticizing this infrastructure development, and yet numerous, I don't know how many patients in Kansas do not have access to the care they need because there isn't the internet infrastructure needed. We've tried, we would have liked at the state level to enhance that opportunity, but it's too expensive. It takes federal funding to make those improvements. And it is a huge issue to me to improve that infrastructure, internet access, so that we have more equitable access to care. Because I see, because of COVID, as a very strong move, not just in business, but definitely in medical care, to the internet and using telehealth. And, you know, KU, Dr. Gary Doolittle, who was the pioneer and helped start the whole telehealth in Kansas, he was in my class, and all of this was new. And now it should be just a routine part of our care and available to all. And yet in Kansas, we have not only a state legislature, but we have our federal delegation voting against expansion of access to care by being against this infrastructure. Now, yes, it's about many other things. I get that, but that is a really big part of the care. Other ways that I've seen that our care is affected by not having Medicaid expansion in our state is for rural hospitals. They need that money, and some of them have closed, and many of them are struggling because so many of their patients don't have health insurance of a kind that will pay. They need that Medicaid expansion to be able to get some money into these rural hospitals so that they can stay afloat and keep providing the care. Why would it matter to a farmer to have a relatively close hospital?
You get into
Why would it matter to anybody? What?
You get into the care desert concern. So like, once again, to bring up Brooks County Hospital, is if you don't have a hospital for miles, what's the situation if you're having a heart attack or a really acute illness?
Exactly. And what does anybody know what is really impacts? What do farmers have so many of that others don't necessarily? Well, I shouldn't ask it that way. Bottom line, they have accidents. There are so many serious accidents that happen on farms. A tractor overturns, their hand gets caught in the machinery. They're using something and they get a big injury with a cut and are bleeding out or whatever it is. And they need to be able to get treated quickly. And I was always shocked that, skin cancer, another huge thing for farmers that they get because they're in the sun all the time. And so many of them, why would I wear sunscreen and let alone a hat? I personally, as an anesthesiologist working with plastic surgeons, the number of farmers, people who had been out all the time that ended up having, most of their ear removed or big chunks of their nose from skin cancers. It's a big, big deal. So they need access to this care. So I think you can see from what I'm telling you, medicine is very, very impacted by what the state legislature decides. And every single thing, all the laws that you have to follow around the practice of medical care are determined by that state legislature. So I was astounded when I went to the legislature and found out that people wouldn't listen to me because I was a moderate or a Democrat or a woman. They thought it didn't count, and they would vote against opportunities to improve healthcare that I would bring forward, such as paying for birth control access, providing state funds so all women have access to it and can afford it, like Colorado does. They pay for it out of their state budget. And guess what their abortion rate did? Dropped significantly, particularly among young people who couldn't afford the long-acting reversible contraceptives and the like. really made a significant difference. But they thought somehow because it was, they made it into a politics rather than just healthcare for people. And it really, really matters to you that you are able to provide the care that you want to give to your patients. That they actually, there are legislatures around the country that are blocking the ability for people to mandate masks. Well, that means there's having a tremendous, great increase in sickness, particularly in the schools. And, that all translates down to you are going to have to take care of these people. And I was in residency at the time of AIDS when it was brand new and there was absolutely nothing that you could do except supportive therapy as you watched every single patient die. And it was an overwhelmingly tragic situation. And now again, it was politicized and care wasn't equal. Now we have treatment for that, but I know how horrible it is to watch and feel and be helpless to save people, to make sure that they get well, to have a treatment of some kind. And keeping that in mind, COVID will not be the last of whatever comes our way in healthcare, right? We don't know what's coming. And we need the ability to treat and know that public health should be decided by people who are experts in that so that it trickles down to you as caregivers. The other thing that affects you is insurance, right? Who's been limited has seen the limitation that maybe an insurance company puts on what you can do for a patient? Yeah. Anybody? I can only see a few of you, but
yes.
Go ahead and speak.
At my job before medical school, I worked for a neurologist, and we had a majority like MS patient population, and the insurance companies wanted them to start with the least effective, most likely to like permit exacerbations and increase disability before they could actually get effective drugs, which like time is your ability. And so we wrote a lot of letters to get people like accelerated so that they didn't, like go blind or develop permanent neuropathies and myopathies because they weren't getting treatment in time.
Yes, it truly matters. And in Kansas, the actual practice of medicine is overseen by the Board of Healing Arts. And just so you know, the governor appoints people to the Board of Healing Arts. So again, it is a political, I don't want to call it a machine, but it is political. And depending on who the governor can impact, obviously, who's on that board and what rules they want to put in place and how they're enforced in the state, overseeing decisions made by physicians. At the federal level, the opportunity to have Medicare, Medicaid, the CDC, all these organizations and opportunities for care that come through our federal tax dollars, it's tremendous. And depending, as we've seen, like right now, the House of Representatives, they've passed a bill to allow states that have not expanded Medicaid, Kansas, one of them, to still be able to access Medicaid by applying individually through the federal government rather through the state government. Now that hasn't passed the Senate, but they're trying to say all people in the United States should have the same access to care. I mean, why should poor people in Kansas, people in need, not be cared for or have different kinds of care available to them than someone who lives in Colorado or Connecticut or wherever it is? That seems out of sync with what I think the United States of America should have as far as care opportunities. I often get asked, what were my favorite things about being in the state legislature? And my answer always goes around to, what were we able to pass bills wise that impacted people's health? That's my first criteria to answer. And my very first year in the legislature, when the balance of moderate Republican Democrats outweighed the conservative arm, we were able to pass, in its 7th year of being brought forward, the Clean Indoor Air Act. Now, in my lifetime, the most significant thing that could change health outcomes in this country would be changing the use of tobacco. Whether it be chewing it or smoking it, it impacts our cardiovascular system, our mucosa, all these different cancers, COPD, coronary artery disease, and intravascular disease, et cetera, cancer of the lung, cancer of the bladder, on and on. And so when we passed that Clean Indoor Air Act, I was ecstatic to be able, rather than just patient by patient affecting outcomes, I could vote and impact thousands, if not millions, of people in opportunity to be healthy. That was really, really significant for me, and probably my favorite thing of ever being able to vote on and pass. Second was being able to actually pass Medicaid expansion. However, the governor vetoed it, and that is still remains not to happen. But the other, so, then moving on to, why would you then run for United States Senate? I saw a tremendous opportunity to help us as we have the Affordable Care Act. It is now so enshrined in our system, there's no way just to end it. I mean, it would totally disrupt care for people. But no one, when it was written originally, no one said this is, written in stone and this is the only way it should be. They knew it still had to be evaluated and changed and grow or reduce or whatever needed to be happening. And I was really, really excited to help work on that, both from my background as a physician, my background as a state legislator, my background as a bioethicist, my background as a mother, and a person who's been involved in helping people who are in poverty. All these things need to come to the table to help us do a better job. And when we have people that just fight it and just say no, rather than saying, how can we work together again to improve health and healthcare and outcomes in this country? That's what I believe that we need in our legislatures, both at the state and federal level. And I would hope to see that. And one of the things for you all, as you vote, which I'm going to assume all of you are registered and all of you are voting, but if you're not, advocating for your patients is your job as a physician, to me. Advocating for your patients. It isn't just advocating for them in your conversations with them to make sure the insurance is necessary for them. It's not, and can you all still hear me? It says my internet connection's unstable. You okay? Okay, good. It's not just advocating for them in the ways that you make sure that the hospital's open and you work hours and all these things. It is also participating in your government by voting and taking the time to know, will this person help make sure that I can practice medicine to the best of my ability and get to my patients what they need? And I think it's beyond important for you to be that advocate for them. And I encourage you, as you visit with your professors on rotations, or as you're doing, your simulations and you talk to people, talk to those people who are have been doing this for a long time and ask them how they participate in that advocacy. Do they have fundraising events for candidates? Because it takes a lot of money to run for office. Do they encourage their peers and their neighbors, et cetera, to vote for people who will help provide and do the things that you want? Do they even vote? Are they registered? Do they help get other people registered to vote? It matters tremendously. And for me, I think it is something that should be included in your interactions. I know it's limited time, but like as we come up this next year with this constitutional amendment in Kansas, why not have information in your offices about the amendment? It doesn't have to be biased on either side, but just information. What is this? What does this wording say? And how is it explained to them? And how will it impact their health care? People need to know this. And that is not being political. That is being an advocate for your patient. And I really believe that that is your job. We tend to only think about the medical part, but we need a holistic approach in the way that we do things. And that includes participation in that very government that affects you and your patients. So there are so many different things to talk about. I have loved that intersection between the political realm, government realm, public policy, and medicine. And there are many organizations out there. You should belong to them to help be a part of that, whether it be your whatever field you choose to be in, if it's the Anesthesia Society or the Cardiovascular Society or the OBGYN, whatever, be part of that. Your local medical society, you need to be part of that, because all those groups advocate for or don't, or try to block bills, legislatures. And sometimes the best thing you can do as an advocate is to block bad legislation. It's not just about passing good things, it's also about blocking bad. And there's not enough time today to go into how bad some of them can be, but an example would be, there was a former senator in Kansas who wanted to outlaw IVF. She believed that that contributed, that if any eggs were left, that was abortion, and she wanted none of that to happen. And oh my gosh, I would take out an entire specialty, let alone the opportunity for so many families to actually have a child on their own. But be that as it may. So I want to stop and open it up for questions, and anything is game, anything at all. And I don't know if we want to raise hands or whatever. So let's have some questions.
I do have a question.
Okay.
So one point of contention that I have is that the other side, so to speak, the like shockingly unscientific, unmedical perspectives on these issues, will still have physicians and other like healthcare professionals who are supporting them or like vouching for their reasoning against like logic and science. And I don't know, like how did you get through medical school unless you're just like lying. But is there a productive way of engaging with, colleagues who are somehow defying like everything we know about medicine to either their beliefs, if it's just somebody we talk to, or somebody who has some position of significance, like what we can do to influence them or like successfully.
U.S. Senator Roger Marshall, who ran against me, who does not, who advocated for using hydroxychloroquine when it wasn't approved, still is very vocal about, well, not really sure, do masks really help or not? I bet he wore a mask in the operating room, but who knows? Maybe he didn't because he didn't believe in them. Those kinds of things. I think that it is helpful to contact and ask questions. You can do so online. You can write letters. You can even call and ask in their offices. I cannot say if you will really get a response that satisfies you, but who knows? When you have literally millions of constituents, it is difficult, but you hire staff to do those things. And my concern has been that we as physicians in our state, we should be holding other physicians accountable to good medicine, scientific medicine, the practice. And I think we do that through the Board of Healing Arts. So it's entirely appropriate. And I know some people have contacted the Board of Healing Arts with questions about other physicians, be they in public roles, that are advocating for things or fighting against good public health measures. And maybe that's what we need to be doing. It's something to think about. I also think good, discourse when people will really have a conversation. So maybe the medical center, every day Dr. Stites is on with that program that he does. Ask Dr. Stites to invite Dr. Marshall to come and be a guest. Or U.S. Senator Jerry Moran, who's running for office, or whoever else. Get them, the only physician, Dr. Stephan is in the Senate. And look up his positions. He's from the Hutchinson area. People like that, that's an opportunity to ask questions and have discussion. And then you guys write papers, talk about these things, get data, do those kinds of things. I think those are all opportunities. And Peggy, I wish there was a great answer because, it's the challenge of the world right now. So next question I see, add a bit of perspective about being an anesthesiologist and a mother. Well, I was so blessed. I had the perfect job. I worked in an outpatient surgical center that had no nights, no weekends, no holidays, and I job shared. So, and I was actually in charge of scheduling all of us. And it was a great opportunity. We could move each other around and we're flexible enough that if one of us had something we needed to do, like go to a school play or be part of the Halloween festivities at school or whatever, I was able to do those things, and my partners were as well. And that was awesome. And when I tried to decide what I wanted to do in medicine, one of the best pieces of advice or combinations of advice, one, figuring out whether I would rather be in a surgical type setting or an office setting. That was a dividing line. And I loved the OR and I loved procedures. So that helped me right away move to, one side or the other. Then I knew I loved children, but I also enjoyed working with adults, both. So I wanted to kind of practice where I could do both. And there are a lot of opportunities there in anesthesia. I also, office work wasn't my favorite. And in anesthesiology, you basically, unless you're doing pain management, you really aren't in an office setting other than your pre-op visit, which you might do in an office setting, but you might just do it the day of surgery. So I loved that. And I knew that I wanted a job that I didn't have to take home with me, because I care too much. It's one of my challenges, but it also helped separate keeping the job at the job and my family. And it didn't have to interact. And I'm married to a family practitioner, so I know what it's like. The phone's always ringing, asking for his help, and he's always busy. And so I knew I wanted to be able to really focus on my family. So as far as my male colleagues in anesthesia, for the most part, it was very hard to get into the governmental structure of the American Society of Anesthesiology as a woman. Very few women were able to kind of break down those barriers. It was hard. I ended up doing that and was president of the Missouri Society of Anesthesiology because I practiced on the Missouri side, and then was able to be a delegate to the ASA. But to try to move up higher than that, nah, forget it. And so I think that was a frustration for me. I realize now, looking back, I really like policy and helping direct policy. And it was very hard to do that as a woman. I don't know what it is like now. I mean, that's more than 20 years ago, but I think it's important. We as women know, well, and men, we have different perspectives. And whether we're male or female, or whether we come from different cultures, whatever it is, we need different voices at the table to help give the best care to all of our patients all the time. I think that's really important. So, what other questions?
Kate, did you have a question? I see your hands raised.
Yeah, I just wanted to ask kind of how you approach getting involved in policy and politics as a physician, and what we can do early on to start getting involved with that.
Well, as I said before, and that's a great question, Kate. Number one is to vote. And I know that sounds like no big deal, but there are votes, there are outcomes that are literally won by 5 votes or 3, or they recount, that starts at the local level. And many people enter the system at the local level, and then they move up. Now, I happen to get in at the state representative level, which isn't maybe quite as common. And yet there are people who literally, like Roger Marshall, who started at the congressional level. So votes really matter. Next is use your access to information, be it through the state medical society, the county medical society, whoever it is that you want to follow. They publish in their newsletters what bills are coming forward. And one of the things you can do, both as a student, as a practicing physician, even as a patient, is testify in committee hearings about the bills that are being moved forward. And many, I can't see everybody, but it is so helpful to have experts come and testify for or against. You'll find the system, one of the challenges is the committee chair has the discretion to schedule a bill hearing, and then they move it to a different day. And you and I both know, as physicians, you need a schedule, and you need to know what day off, who's going to be going to do these things, to testify, et cetera. So, but we need that to happen. And it does help coming from a big medical school, a big complex where you can have a couple people on standby. So whoever it's their day off, they can go and make those points known. And even if you can't personally testify, you can send in written testimony. And all of you, just so you know, like University of Kansas Medical Center has a lobbyist. that advocates for the medical center up in Topeka, but you could ask that lobbyist to be getting information to you about bills that affect the practice of medicine, so you know, or and keep you informed. And I would bet that many people don't even realize there's a lobbyist that does that, and I think that's really important. What else, and this is just an aside, to participate, it just came to mind that I want you to know. The State Medical Society in Kansas refuses to participate in any way with any bill that has to do with abortion. They frequently don't even put it up as this is coming forward. And I find that a tragedy and something that needs to be changed. And that involves electing people into that medical society that will help facilitate getting those things to be addressed. But don't count on them to be working to help get information to people, for instance, on this constitutional amendment, because they won't participate at all. I'm thinking of other things that you can do. Again, getting to know your state representative, your state senator, your congressperson, just by offering yourself up, saying, I'm, Dr. So-and-so or med student so-and-so, and I want you to know if you have questions about certain bills, I'm here as a resource for you and would love to be available. And when they're not in session, schedule a meeting with them to talk through bills. Or if you want to get together with a person like me, other than a talk today, but to go through and find out how you follow these things and how exactly that process works, I am more than happy to facilitate that, because it is confusing and different. And following the website of the Kansas legislature, it's hard to follow bills. Again, that's where your lobbyist can help. But getting more people involved in teaching you how to best be an advocate is really, really helpful. Other questions? Is anybody there?
I have one. So you talked about how medical issues end up getting made into a political issue. Is there a way we can start reframing the conversation and start separating it from politics so we can have a real conversation about here's what science is telling us and why this shouldn't be a political issue?
Lauren, if there was an answer to that, oh gosh, I honestly don't know how. Well, there's lots of books to read about why that has happened over time. I certainly think the internet has been an influence on that. I also think in today's world where people choose to listen to for news, and I'm putting quotes around news, they listen to one kind of news or another kind of news. And until we can get back to unbiased, actual factual news, like when I grew up and people like Walter Cronkite just gave us the news and it wasn't politicized. I don't know how to change that over time, other than being a person who calls it out and works to have conversation with others to try to actually get the facts out to people. I was actually, any of you ever eaten at Billy's Grocery that's down by Costco on Gillum? If you haven't, it's a great place. It has all this vegan, gluten-free opportunities for food. It's wonderful. But when I was eating out on the patio, there was a group of people at another table, and there was a discussion going on between these people about whether to be vaccinated or not. It was killing me not to participate in it, but I was really pleased that at least they were willing to have the conversation. Now, the one who was against vaccination got really angry, and it was not pretty. But those are the kind of things that we need to be doing and encouraging others to do, to have real conversation. And again, calling out people who put false information up. You know, that's something that needs to be done. And most of us are kind of afraid to do that. But if you follow a person like me on Facebook, you'll see me calling out when something is incorrect or false. And I think it just needs to be done. And yeah, I get a lot of criticism or hate mail or hate, phone calls or ugly people, saying what they want to say. But truth telling to me is imperative, and facts matter. And I think we need to keep insisting that it happens. And it goes back again, when we see other physicians not following science, connecting with our Board of Healing Arts and calling that out and asking them to investigate seems appropriate to me as another way to impact that. And let's hope this changes, because it's not helpful for the public. All right, Sam, are you still there? I saw that you were on this. I met Sam also doing vaccinations at the clinic. Do you have any questions?
Okay, well, first of all, I'm honored that you remember me, so thank you for that. Yeah, first of all, so great to hear everything that you said. And also, as an aside, I was just talking with a friend, Emily, about maybe going to Billy's Groceries. So it's great to hear. It's great to hear an endorsement for that too. Something that I've been thinking about, but was a little, I guess, worried about was, I know you mentioned how even, KUMC has a advocate in the legislature. And, I think something that we all as members of various student organizations here might be concerned about is, if we are trying to lobby our institution to make changes, like, for example, if we are trying to get them to support climate change initiatives, how concerned should we be about the legislature interfering with that? And should we try to pare things down to be more palatable, so as not to anger the organization that funds us?
Sam, you hit the nail on the head because it is difficult to push a group when they also are they feed you. They are the ones that fund. Now, the trickiness, and I would encourage you all to bring in the lobbyist and ask to explain all these differences, like between the medical school and the hospital and the physicians group. They all are separated, and they're different, and they have different interests. And the medical school is part of, funded by the legislature, et cetera. But the hospital, it's a different organization and has a totally different relationship. So those are important things to, parse out and understand the differences. I used to, Bob Page and Tammy Peterman, who are the CEO and CEO of the hospital, always have a legislative dinner every year to talk through issues with the medical center. And they were always advocating for Medicaid expansion, et cetera. But the group, they would never really push on some other issues because they were too afraid they wouldn't be funded. And that they would anger. And my point was always, these people don't like you already. Most of them, they're not about higher education and they don't fund you. So I think they need to be a little more aggressive. But again, that's up to people like you. You have to start having relationships with those people and then advocating for or pushing things that you want to see happening. And I know it takes time. And I'm the mother of a medical student, and I was one, and I know there isn't a lot of time, but it is important to do. And certainly encouraging your faculty and the staff and other physicians to advocate for those things. They need to make the time because it impacts you, it impacts them, it impacts, most importantly, their patients. And that's what we should always stay focused on, to me. So I
Thank
see
you.
that our time is like up and you probably all got to go to class. So holler at me anytime. Sam and Emily know this, and they've got my cell phone number. You can text me, you can email me at barbarabollier at gmail.com, no dots, no other than the .com. And I'm always happy to visit, to direct whatever it is that you need help with. Don't hesitate, because I am now retired and I've got time. And I really, really enjoy trying to facilitate people to understand the system better and help make it the best it can be. So thanks for having me today. And I wish you the best in your studies. And good luck in all your decision-making as you decide what you want to do later. So be well.
Thank you so much, Dr. B. This was really inspiring.
Well, medicine is a gift to be able to practice it. Don't ever take that for granted, that people are giving you their life. And I consider that the greatest privilege of anything that I've done in my life. And I hope you will always treasure that privilege, because it is a privilege. So take care. We'll see you all later.
Thank you so much.
Bye.